Well, welcome everybody. We're really happy to have you here for, a discussion of an incredibly important topic and a topic that both Lori and I are very dedicated to helping women with, which is the topic of sex after cancer. And we put that this is a candid discussion. This is not necessarily an easy topic to talk about, but I want to make sure that everyone knows this is a topic that Lori and I talk about often, and absolutely welcome, any comments, questions, pertaining to anything regarding sex after cancer. And so please, this is a safe space and a space where we are, very open about talking about pretty much everything in this category. And I know Lori agrees with me. So just a little bit of background into terms of who we are. So I am a gyne oncologist by training, and work here at UW Health as an assistant professor in the Division of Gyne Oncology. I am also a provider in our UW Women's Integrative Sexual Health Clinic, or the WISH Clinic, and we're going to talk a little bit more about that clinic during our presentation tonight. I'm also a member of the Scientific Network on Female Sexual Health and Cancer, which is a network of providers, researchers, people across the country really dedicated to this area in improving this really important side effect and survivorship issue for our patients. Lori is as well. And I am also have been a quality of life and cancer survivorship researcher for over a decade now. So really somebody who, I'm very dedicated to the academic and research side of improving side effects of cancer for the patients I take care of and, cancer patients in general. I am gonna let Lori introduce herself and kind of let you know her background and let me see. Yeah, perfect. Go ahead, Lori.
Okay. Hi, everybody. So I spent 11 years working in gynecologic oncology, which is where Janelle currently works. We didn't overlap, but when I moved to the breast center in 2014, I started learning a lot more about breast cancer specific issues. So while in the WISH program, we take care of women who have had cancers of all sorts. Primarily who I work with in most of my clinic days is women who have breast cancer at this point. And yeah, I am one of the providers in the Women's Integrative Sexual Health Program. We started our program in 2013, and I also am a member of the Scientific Network.
Awesome. Thanks so much, Lori. So just a couple goals tonight. We're going to have this kind of split in two parts. So we're going to do sort of a bird's eye view overview of some of the issues in this area, which is going to include just kind of an overview and some of the changes women experience sexual health after cancer. We're going to talk a little bit about, navigating conversations with your provider, your partner, if you have one, about sexual health. We're going to go through a couple of really, really good resources that are available, including a bit of insight and overview of the WISH clinic that we have here at UW. And then, we're going to have a little bit of kind of a breakout, ask questions. As Jackie mentioned, any questions that you guys have that you'd like to ask us, more anonymously, you can go ahead and send those to Jackie or Cheryl. And, certainly if you're comfortable, we're going to have a nice opportunity for some Q&A. With that said, we do have a couple of questions via poll just to get an idea of who you guys are. So I'm going to have Jackie kind of put those poll questions up now. All right. So this looks like exactly what Lori and I see in our WISH clinic, which is that, many people with cancer have a lot of, symptoms related to sexual health, oftentimes happening, over the course of treatment, following treatment. And I appreciate your willingness to be, open with us in these polls. We're certainly going to talk about all of these issues tonight. So thank you so much for sharing that with us. And I hope it makes all of you realize that you are in the company of people who share similar changes, and that, you're certainly not alone with those things that you put in the poll. All right. Which is a great segue into the next slide, which is who is impacted. And really, the short answer is almost everyone, and this is true for both men and women with cancers, is almost everybody experiences some sort of change in their sexual health following a cancer diagnosis and cancer treatment. There are good data out there, and those data estimate about 40 to 75% of women experience changes in sex after cancer. There certainly are sources that even up to 100% of women experience some sort of change in sex after cancer. And these changes can be large, these changes can be small, they can be temporary, they can be permanent. Really, almost everyone has some type of change in their sexual health during this time. What types of cancer treatment can cause changes in sexual health? Pretty much all of them. Certainly surgery, we've got looks like a group of breast and gynecologic cancer patients, certainly surgeries for breast cancer, surgeries for gynecologic cancer can cause a lot of changes in sexual health. Chemotherapy, we know, can cause changes in health for patients, even if it's just the, fatigue that comes with chemotherapy, the hair loss affecting body image, nausea, vomiting, changes in the bowel, all of these things can come together to change someone's sexuality or sexual health during that time. Radiation therapy is certainly commonly used in both breast and gynecologic cancer. Radiation can cause a lot of changes, certainly to the vagina, the vaginal mucosa, the breast tissue, and hormonal therapy, certainly. Hormonal therapy more commonly given to patients with breast cancer, also given in many gynecologic cancers, and that can cause a lot of changes. One of the biggest changes we see with hormonal therapy is a decrease in female hormones. Mostly, the biggest impact is a change or decrease in estrogen that can have a lot of impacts, both anatomically on the sexual organs and sexual tissues, but can also affect, things like sexual drive and libido. And what types of cancer? We're talking a lot about, breast and gyn tonight, certainly because of our audience. But what we know is that, people with pretty much all cancers can have changes. That can include, people with blood cancers like leukemia, lymphoma, patients who have colorectal cancer, head and neck cancer, lung cancer, across the board. These, treatments for cancer can cause a lot of side effects and cause sexual side effects in nearly everyone. So what kind of sexual changes or sexual problems? As probably everyone on the call knows, PowerPoint gives you a lot of different design issues. And, I really liked this design recommendation by PowerPoint because I think, these problems, it's not just one problem, right? One problem or one symptom can impact another symptom, which impacts another. And, I think for a lot of our patients that suffer with sexual changes, this can feel a little bit like a vicious cycle. People can experience, certainly vaginal dryness from those treatments we talked about, difficulty lubricating with sexual arousal, pain with intercourse, pain with sexual activity, certainly low interest in sex and low libido is really common, difficulty achieving orgasm or changes in the ability to orgasm following cancer treatment, changes in body image. That is something certainly that comes along with cancer treatment, particularly for women who have had breast surgery or breast removal, changes to, the female genitalia from radiation treatment or surgeries, of the vulva or vagina. And then, these things can be really hard to talk about with, people's intimate partners, and certainly can be difficult talking to your doctor or your healthcare providers. And so, all of these issues are, pretty entwined. And I think for a lot of people can end up feeling a little bit like a vicious cycle. One of my mentors and now colleagues, and one of Lori's colleagues, Dr. Stacy Lindau, published this interactive model of sexuality a handful of years ago. And, we're not going to get into the detailed details of this model, but, I wanted to include it because I think what's so important to know about sexuality is that there are so many moving pieces that come together to be someone's, sexual health and sexuality experience. This model, what it shows you here is that, you have individuals whose sexuality include their, sexual interest and libido. It includes your body and how your body functions, right? It includes opportunity for sexual activity or sexual encounters. And, not only do you as an individual have all of these pieces coming together, but your partner also has all of these pieces coming together where, it's the biology, it's your brain, it's your emotion, and it's your social context, right? And these things come together in order to create a sexual, encounter between two people. But there's a lot of pieces that need to come together to equal a satisfying or pleasurable sexual experience for someone. So, how do you bring this up to your provider? I think that, there are a lot of things that come into this. And one of the first things I think that's so important that I hope everyone leaves with tonight is arm yourself with knowledge. Okay. So this is common. There is so much data out there, right? Remember, I said almost everybody suffers with a change in sexual health after cancer. This is a common problem. The second thing is that this is really important. Sexual health and a person's sexuality is an incredibly important piece of who they are as an individual and is an incredibly important piece of a lot of relationships. This is common, this is important. That alone should be enough to bring this up, to your provider. What's also important, I think, to know is that nearly all cancer organizations support attention to this issue. I think we've come a really long way, certainly in the past decade, of really recognizing that sexual health is important. It's important to people, it's important to cancer survivors. And, many of our cancer organizations support this important side effect. I think what's also really important to know is that, your cancer providers, your primary care doctors who know you're going through cancer treatment, your providers want to help. They may not be equipped with the expertise to be the person that addresses these issues with you, but they want to help. They want to connect you to resources that, do have that expertise. But in order to help, they have to know there's a problem, and it can be really hard. It can be really hard for somebody to bring it up. I think that there's been, some surveys of both patients and providers. And what's really interesting in that work is that patients think it's important and they want their providers to bring it up. And on the flip side, providers think it's important, but they want their patients to bring it up. And so I think everybody, is recognizing this is an important issue, but it's hard to know who should bring it up and when should they bring it up. And, is my provider going to have a good reaction and know what to do? But I think that, all signs point towards people wanting to, providers wanting to help patients with these issues. But, there's lots of barriers to that, right? Patients can feel like it's an embarrassing thing to bring up. Providers can feel embarrassed bringing it up. There can be some barriers there that certainly can impact communication about these issues. I think that, recommending be straightforward. I think be straightforward and don't assume your provider is going to bring it up, right? And I think statements like, hey, cancer treatments have affected my sexual function. Is this something we can talk about more? Especially for our patients in your, I think about 2/3 were in surveillance. Surveillance is a great time to start bringing up side effects, particularly when you're in a phase of cancer treatment where, you're not undergoing active treatments, bring things up, side effects. This is the time to talk about side effects. How do I improve them? What can be done upfront about them. And sexual side effects should absolutely be a component of that if you're someone that's having issues. For our people in the group who are in cancer treatment, during cancer treatment is still an absolutely appropriate time to bring this up. Hey, I'm in treatment, I'm having XYZ problem. Is there help for this? Is there ways that we can prevent this from worsening? How do you think my cancer treatments are impacting the side effect that I'm having? I think what can be really helpful too is if you don't think your provider is someone who has the expertise for that issue, describing the problem and asking if they know an expert. Do they know someone they can refer you to? Do they know any, resources either locally or, online that can help, even if you don't think they're the person for that particular side effect or to treat this, do they have a person they can refer you to? Is really important. What also is really important is that if you anticipate future treatments, asking if they, your providers anticipate that treatments will have an impact on your sexual function. And if they think they will, are there anything that, things that can be done now to prevent or address, symptoms that they anticipate you may have early, before things worsen. Another important area of communication is how do I bring this up to my partner? This is hard stuff, and sexual changes because of cancer treatment can really change the sexual life of people with their intimate partners. Like anything, I think timing is everything, right? Finding a time where you're able to talk to your partner in a calm environment, not when someone's running out the door. I think certainly Lori and I in our work with our patients in the WISH clinic, sometimes the problems being brought up in the middle of a sexual encounter, oftentimes we hear from patients we care for is not great, so bringing that up in a calm environment where people have time, you and your partner have time to talk about it really makes a big difference, certainly. And I think bringing up these issues at a time where you're not, in the middle of a sexual encounter, oftentimes is a better place to bring up those issues. I think being honest, when you are someone who is going through or has gone through cancer treatment, there can be so many changes to your body that you haven't had a lot of control over, and being honest about what those changes are and how it is impacting, your sexuality is incredibly important. Be detailed, include details about what you're experiencing, right? If it is vaginal dryness or pain, those two things can often come together when it comes to intercourse. Saying, I am feeling pain. I think it's from dryness, and saying when you're feeling pain. Some women experience pain on initial insertion with intercourse. Some women experience pain with, deeper penetration. Really letting your partner know, where and when in the sexual encounter you're experiencing symptoms can be really helpful, because it can lead to some brainstorming about, ways that you can overcome, particular times or activities that are causing that discomfort. What it can also do is help kind of cultivate a different sexual experience, right? So what we know, even for people who, don't have a history of cancer or cancer treatment, what we know is that sexuality and sexual encounters and, people's sexuality change so much over the life course. Sex when in your teens doesn't look anything like, sex when you're 40 or sex when you're 60 or sex when you're 90, sex and people's bodies change over time. And so that sexual experience, it's really common for it to change. A lot of times people with cancer have changes related to what's happened to their body, right? And so having that open mind, working with your partner to cultivate what that new normal sexual experience is going to look like can be really, really helpful. I put in here, get creative with intimacy. I think, for some people, sex has a narrow definition. For some people, sex has a really wide definition, but, getting creative if intercourse, vaginal intercourse, anal intercourse, becomes uncomfortable during cancer treatment, it isn't the only kind of sex, right? There's mutual masturbation, there's outer course, there's oral sex, there's ways to have intimacy that aren't necessarily, penile vaginal intercourse. And so, some people can find a lot of intimacy just from cuddling and kissing and, spending that physical touch time together, that may not look like what it's traditionally looked like, but can still be a positive and intimate experience, for both partners, even though it's not what it's always been in the past. And I put on here again, seek help when you need it, bring it up to somebody, in your medical provider, and a lot of times, what we find in the Wish Clinic is that it's not always the cancer doctors who are, finding these issues and, things. There's a lot of providers on your team. Lori is, a physician assistant in breast cancer. She's seen a lot of patients. We have nurse practitioners. Bring it up to your nurse. There's a lot of people in the care network who are happy to help. And I think, bringing that up to anyone who's comfortable, it doesn't always have to be, your cancer doctor or physician. It can be any of the providers that you see, and let them know that there's an issue and that you need help. So how do I get help? I think bringing it up, certainly for any of you who are being seen in the Madison area, what I want to make sure we talk about, at least for a few minutes, is the WISH program. So Lori and I mentioned we are both providers in the Women's Integrative Sexual Health Program. We work with an awesome team that also includes a few other advanced practice providers in our group. And, our program is a specialty clinic that is completely dedicated to helping women with cancer and their sexual health. That's the entire purpose of this clinic, is helping improve this really important quality of life part of cancer survivorship. A little insight into what happens in the WISH clinic is we do an initial consultation visit, which is usually, about 45 minutes to an hour. And that is just a consultation to get to know you, get to know your medical history, your sexual history, current issues that you're having. And that visit also focuses a lot on education, kind of a deeper dive into some of the things I previously mentioned, where, we get to really personalize education for our patients based on what they're suffering with. And then the second visit is we do a complete physical exam, including a really comprehensive pelvic exam, to really try to figure out exactly what is causing symptoms, causing problems that people may be having. And then, we customize a treatment plan based on that conversation and that physical exam. There's a lot of things that can be done to help with sexual problems after cancer. Things that we do in terms of treatment for patients, it's individualized, but can include a lot of education about how to approach things related to sexual health. Vaginal moisturizers and lubricants are nearly universally recommended by us, and something that we spend quite a bit of time talking about. There's vaginal dilator therapy, which can help with a lot of different sexual health problems. Pelvic floor physical therapy, we work with an awesome group of physical therapists who are really dedicated to helping women with issues related to their pelvic floor. We also work with an awesome team of counselors who can help with sex therapy, and that can be, sex therapy for individuals. It can also be sex therapy for couples who are interested in pursuing it. And then there's, many other referrals and things that we can help connect our patients with specialists for, related to their individual needs. There are also a lot of other resources out there. This is a very short list of some of, what we think are the best resources out there. One really important resource in the Madison area is a Woman's Touch Sexuality Resource Center. It is a really lovely center that not only has, products, but also has a lot of education. They have a really nice website that has, a lot of just publicly available resources to people, and have a really, really nice place to, have to get products locally. If you aren't, kind of ordering things to help online, that can include, anything from moisturizers, lubricants, intimate toys, as well as a lot of education. It is just like a really, really lovely place. Lori, you have been, I think, more familiar with Women's Touch even than I am. Is there anything else about a Women's Touch that you'd like to share with the group?
Well, the only thing that I would add is that it is currently run by a woman who is a social worker and a certified sexuality educator, and she does individual consultations with people. So in addition to being able to buy things like lubricants or, books on various sexual topics, you can get one-on-one discussions with her. And I think that's a really good adjunct to kind of what we do. We share a lot of the patient education resources that have been created by a Woman's Touch. So for the patients that come to see us in our WISH program, some of the materials, the education materials that we give to them were actually created by those folks over there. So yeah, it's a really wonderful resource.
Yeah, awesome. Thanks so much. The other couple of resources out there are more web-based, and Jackie will be emailing these links and names out to you guys after the session tonight. But the Scientific Network on Female Sexual Health and Cancer that Lori and I mentioned, it's got a little bit more of kind of research and academic information, but there also is a really nice resource page that has some good reading materials from different experts and colleagues that Lori and I have across the country. So that is certainly something to check out. Woman Lab. So Woman Lab is also an excellent sexual health resource that has a section dedicated to sexual health and cancer. This website was developed by Dr. Stacy Lindau, who works at the University of Chicago, and was really a huge pioneer in starting to do research and, treat patients with sexual changes after cancer. It's a really, really lovely resource. Has, some patient information, kind of brochure style, recommendations. Also has some really nice blog posts, as well as some really helpful videos that Dr. Lindau and her team have curated over time. So certainly a really, really nice resource by someone who has done a lot of work in this area. And then the American Cancer Society also has a really nice section on their website for sexual side effects of cancer. And that is available, for just available publicly. I think they've done a really nice job kind of breaking down different sections, some lessons in anatomy, how different treatments can affect people's sexual organs and sexual health. And, certainly well vetted by the folks at American Cancer Society. There's a lot of other resources out there, certainly not a full comprehensive list, but these are a few of some really excellent resources, both here in Madison and available online.